All right. Thank you everyone for being with us for this evening's Healthy Living Series presentation. These are events presented by Dartmouth-Hitchcock Health, and tonight we're going to be talking about coping with seasonal stress, depression, and sadness, especially during COVID-19. Thank you so much for being here. My name is Angelica Ladd. I work in external affairs here at Dartmouth-Hitchcock Health, and I'll be kind of like a guide for you this evening. And I'm really honored and glad that we could have Dr. Steve Cole, PhD from Dartmouth-Hitchcock Health's Employee Assistance Program, and Susan Stearns from NAMI, New Hampshire. NAMI, New Hampshire has been a great partner in presenting this event. So thank you both for being here. And I'm gonna get into real quick bios for them in just a moment. But I'd like to do a couple of housekeeping items. If you have questions throughout the event, please use our Q&A function, and we will likely get to those questions at the end of the presentation. I'm sure our presenters will be able to answer those questions for you throughout the presentations. As always with these events, we have a post-event survey which will be sent to you as soon as you log off. So if you could please fill that out, that helps us with future programming and helps us to really gauge that these events are working for the community. So we thank you in advance for filling those out. So that's just a couple of the housekeeping items. This event is also being recorded, and it will be available on YouTube within the next week or so. So when that is available, we'll send you a follow-up email just letting you know that it is available. So now I'd like to introduce our presenters tonight. We have Steve Cole, PhD. He's a clinical psychologist serving as manager of the Dartmouth-Hitchcock Employee Assistance Program, EAP. His areas of practice include employee assistance, adult and adolescent psychotherapy, couples therapy and parent guidance, substance abuse treatment, work group consultations, and teaching training and clinical supervision. Dr. Cole received his doctorate in clinical psychology from the University of Minnesota. He completed his internship and a postdoctoral fellowship in child and family psychology at the Geisel School of Medicine at Dartmouth. He is a clinical instructor in the Department of Psychiatry at the Geisel School of Medicine here at Dartmouth. So thank you for being with us, Dr. Cole. And we have Susan Stearns, who is Deputy Director of NAMI, New Hampshire, the National Alliance on Mental Illness. She has worked in the nonprofit sector in New Hampshire for over 30 years, advocating for families, children, and individuals with disabilities. She serves as the facilitator of the Hillsborough County Coalition on Mental Health and Justice, and is a member of the Governor's Commission on Disability, the board of directors, and she's on the board of directors at the Lakes Region Mental Health Center, the New Hampshire Justice Involved Veterans Task Force, and the New England Advisory Team for the region's SAMHSA, I hope I'm saying that right, funded Mental Health Technology Transfer Center. It is her personal experience advocating for her loved ones in both the child and adult behavioral health systems that drives her passion for transforming New Hampshire's system of care in order to improve the lives of all Granite Staters affected by mental illness, So I would just want to really thank you both for being here tonight. We're so glad to have you. I'm going to turn off my video and mute myself now and just hand over the mic to Dr. Cole, who will talk at length about our program. Thank you, Dr. Cole.
Thank you, Angelica. Let me share my screen, if I may. So first of all, I'd like to acknowledge the service of our veterans and thank you for your service. Appreciate it very much. We all do. So it may sound, without everything that's going on, it may sound a little silly to talk about a definition of stress, but pardon me for this. You'll see why I want to talk about this in a moment. Okay. So I'm going to talk about stress and the causes of stress. I'm going to do a very quick exercise. What's stressing you? We'll talk about how COVID is affecting our mental health, why the holidays are stressful for most of us, or many of us, and stress in a time of COVID-19. I want to talk about an exciting model that comes out of the Center for Research, National Center for Research on Post-Traumatic Stress Disorder at the VA, and how to apply that, because I think it can be helpful for all of us. And then Ms. Stearns is going to talk about some mental health resources, and including, I've also included some links to CDC and other sites that will help you to weigh the risk benefits of what kind of celebrations you might want to have this year, this very unusual year. So stress is the discrepancy between demands and resources, and you can think of it like a bank account. You know, the demands are the withdrawals and the resources are the deposits. And but it gets a little more complicated than that, because it's really the perceived demands and perceived resources. In other words, what I feel is really stressful, you may not find stressful at all. And you might think I'm really good at dealing with certain things, and I might think I'm not good at that at all. So our perceptions of stress and our own coping resources really impact how we see the picture, how we react to the picture. So causes of stress, I'll just run through this quickly. So environmental situational stresses are examples like living through a pandemic, or more common environmental stressors like noise, pollution, traffic, extreme weather, or closer to home, problems with housing or finances. Social, of course, relates to people stress, can include relationships, families, and work. Physiological stress is the toll that life takes on our body. Can include illness, or it can include normal aging, lack of exercise, or sleep and poor nutrition. Mental and psychological stress is our thought patterns and how we stress ourselves with the way we think. And this includes our perceptions, our negative thoughts, our tendency to have negative thoughts, what some people call our inner critic, that really cranky voice in your head. And our reactions to stress depends in part on our experience and our personality, and also what our internal and our external resources are, how we talk to ourselves in times of stress, whether we have people we can turn to when we need to, and other actions that we can take to manage the stress and take care of ourselves. And also what our history with our mental health is. Have we struggled with mental health problems in the past? Because in times of great stress, like we're seeing now, it becomes even more important to be more intentional about self-care. So with that little introduction, I want to ask you to just jot down the top 3 things as you think about your life right this moment. What are the top 3 things that are stressing you? Don't think too hard, just 1, 2, 3, just scratch them out. And the second question I want you to consider is, how much control do you feel you have over each of those stressors? And you could do it as a percentage. So it might be none, as in when the vaccines are available, or it might be 100%, like which route, whether I bring my car in for service because of that noise. But the point is this, that when we worry about things that we don't have control over, or we don't have much control over, then we suffer needlessly. And so that's a theme that I want you to think about as I move through some other ideas. So how is COVID-19 affecting our mental health? So first I'm going to talk about how stress can become physical, in addition to physical problems causing stress. And nationwide, recent surveys have pretty clearly indicated that the rates of mental health problems such as depression, anxiety, and thoughts of suicide have gone up during the pandemic. That's from recent survey information. And while it may be a little early to assess how much this stress has affected people's physical health, a recent NPR article reported that the percentage of medical claims, that is insurance claims related to conditions either triggered by or made worse by stress, such as multiple sclerosis or shingles, for example, have really gone up dramatically. And for example, insurance claims for the autoimmune disease lupus have risen 12% this year compared to the same time period last year. Prescriptions for sleep problems, for anti-insomnia medications have increased 15% over these past 8 months. So the impact of the pandemic on our physical health is attributed to the production of stress hormones, such as adrenaline and cortisol, resulting in increases in inflammation and the immune system just not functioning quite as well. The good news is that these physical changes are reversible, but it pays to really work on managing your stress now. And there are evidence-based techniques which won't surprise you, or I don't think they'll surprise you. Exercise, even low exercise, can make a difference. We're talking about 20 minutes 3 times a week can make a difference. Being intentional about getting 8 hours of rest. And I say rest on purpose because we can't make ourselves sleep. Sometimes it's paradoxical, the more we try to get to sleep, the harder it is. But you can certainly make yourself rest for 8 hours, and that's important. There's meditation and mindfulness and social connections, learning something new, especially creative pursuits, such as painting or writing or taking a cooking or a language class online, of course. And all of these activities, I think, help people to shift their mental focus and to gain a different perspective, which can make us feel more hopeful, which is really important. Surge capacity is what psychologist Ann Maston calls the coping and adaptation mechanisms, both mental and physical, that we call on in stressful situations. It's sort of like our coping savings account. In chronic stress situations like the ones we're currently in, it's all withdrawals, and we need to find ways to build those resources up. As Dr. Maston pointed out in a recent article, this pandemic is really a once-in-a-lifetime event, and we expect an awful lot of ourselves when we think we should be managing it well. How could we manage it well when the new normal is uncertainty? We've never been here before. So if we struggle sometimes, that is normal in these abnormal times. Unlike the damage from a natural disaster like a hurricane where you can look out your window and see it, this destruction is more invisible and it's ongoing. Everything's been changing, work, school, home life. So we tend to underestimate how much this has all been impacting us, and it's perpetually changing. So the first step to coping better is to acknowledge that it's been hard, to acknowledge the losses, which are large and some small. Secondly, we have to expect less of ourselves. We're not going to be in our absolute peak right now. And to be a little bit more flexible in how we cope. Some of us can be kind of perfectionistic and have certain ways that we like to get things done. And in normal times, that can be a real advantage, but taken to the extreme, it can kind of box us in and limit the possibilities for getting more support or solving the problem a different way. So how can you build up your resilience bank account, if you will? There won't be any surprises here. It's focus on sleep, nutrition, exercise, meditation, self-compassion, gratitude. Oh, I forgot my joke. And you want me to be cheery while I cook the turkey. And there he is. So there's no surprises here, but these things really make a difference. And the good news is that even doing some of them a little bit can make some difference. And what's more, it isn't just that these things are helpful, which they are proven to be, but it's also just that we're doing something, that's a way for us to be proactive and to kind of take back control or a sense of control when we feel like there's so much that's not within our control lately. The other thing I want to say is if you have been in mental health or substance abuse treatment, you want to make sure that you find ways to stay connected. And this is going to be especially true in the coming months and over the holidays. Have a plan, and there are ways to stay connected, and we'll give some of the resources in a few minutes. So let's examine, if we may, why many people, if not most people, find the holidays stressful, even in non-pandemic situations. So these are my top 10. The first one is the personal that we expect ourselves to be cheery at all times. Like people will say, "What's wrong with me? I don't feel merry." Well, actually, the holidays can be very stressful for many people, or even a sad time for many of us. And then you throw the pandemic on top of that, and that's a lot. So what's the solution? The solution is to give yourself permission to be honest with your feelings. Talking to a friend, someone you trust, talking to a family member, a pastor, maybe your employee assistance program at your work. All of these things can help us to normalize our experience. Too many responsibilities. So getting overloaded is normal and common this time of year. So what's the answer? Well, one answer is to make a list of everything you want to get done between now and New Year's. And when you've done that, ask yourself, am I overcommitted? Do you really need to do everything on that list? Do you really want to do everything on that list? You have to be realistic and be a little flexible. Like the question I recommend is, what's good enough? In other words, what's the absolute minimum I need to do to complete this task? Will these tasks make a difference a year from now? Will that toy be remembered? Will the fact you made 3 different kinds of cookies be remembered as opposed to one? or none. Trying to change or control other people's feelings. Now, this is going to be a big one this year because our country is so polarized. And you will, if you decide that you're going to try to get together with family, you will encounter people that have different opinions about COVID-19. And you may have some difficult conversations that you have to have. Not everyone perceives the risk of COVID-19 the same way. And it's also true that not everyone runs the same health risk. But you have to do what you need to do to protect yourself and the people you care about. And part of that risk-benefit calculation is what's your role. Are you thinking about hosting an event? Are you thinking about not hosting an event? And who's in your household? Like, who might be affected? Like, are there people with pre-existing health risks that put them at greater risk if they were to develop COVID? So those are the types of things that you have to consider. You also have to consider the behavior of the people that you might be inviting or thinking of visiting. Are they going to take safety considerations seriously or not? But the point is that you may have to make a difficult decision, and it's really about how you feel about this. You don't want to be arguing about the science or the politics. Let them know how you feel and what you have to do, the decision you've had to make to be comfortable. And it might mean canceling the event this year. It might mean telling people if you do get together that they'll have to wear a mask, and you just have to kind of stick to your guns and simply state your feelings and your decision, but don't try to convince them that this is the right decision. This is one of those instances where you want to be happy. You don't need to be right. And just try not to be drawn into arguments. You can suggest other ways to connect over the phone or over the internet, sharing a recipe, making the same food and then just trading notes. And it's okay to be disappointed. It's okay for them to be disappointed. People are entitled to their feelings, but you need to do what you feel is the right thing. Painful losses are often brought up around the holidays when people are used to getting together with families. That you may have lost someone in the last year, or there may be some memories from your past around this time that were pretty painful. And what I suggest is that you can't forget the past, but try to focus on the memory and not the pain. You can promote the healing process by sharing memories with others that you want to keep. And you want to strive to establish some new holiday traditions, some new experiences with families and friends, even if it's remote this year, to sort of move those unpleasant memories to the back seat. We're not going to kick them out of the car because they're part of us. They're part of our history, but we don't need to have them splattered across the windshield so we can't see where we're driving. Number 5, overdoing it. Sometimes people find themselves being surprised by, sudden fatigue or suddenly feeling very emotional. And it may be that memories are getting triggered, or it may be that you're just trying to do too much. Trying to be perfect, the Norman Rockwell illustrations. And so one solution. My suggestion for the overdoing it is, make a plan that if you get upset and you with other people, have a plan to sort of change your immediate surroundings and just give yourself a few minutes to recoup. Maybe you just go into the restroom and just have a couple of minutes to just sort of take some deep breaths and try to come back and center. The perfectionism. So one suggestion, and the nasty side effect of perfectionism is that then we inevitably may not rise to our expectations, or others may disappoint us. So we may fall into blaming ourselves or blaming others. So one thing that I would suggest is that you just make a mental inventory of what your expectations are for the holidays, and just try to scratch off the ones that you can look at objectively that just seem unrealistic or lack flexibility. Because whatever happens this holiday season, we can be sure that there's some things we didn't see coming. There's going to be some surprises. Plans are going to have to change on a moment's notice. And so you want to kind of think a little bit about how do you want to plan to deal with that should it happen. People call that coping ahead. Procrastination, that's my favorite, and I'll give you some advice because I'm not using it. It's one of my main problems. So you just want to be aware of this avalanche of last minute to-do things, which stress us out in a stressful time. And so you want to try to make lists. Personally, I can overdo it with the lists and get a little obsessive. And so what I've learned to do is to just focus on 2 or 3 things that I want to accomplish over the course of a week rather than today. And that gives me a little bit more flexibility. If I'm having a really busy day and I can't get to it, the thing that I want to accomplish, then that's okay. I don't feel stressed about it, and maybe the next day will be more productive. The other thing I wanted to mention is unresolved family conflicts. This is the stuff of holiday family comedies, but it's also can be very painful. And again, cope ahead by having a plan. If Uncle Harry does his thing, and offends you in the way that he always offends you, have an exit strategy. Have something you can say to buy yourself some time, and just don't take the bait. Travel, of course, and debt are 2 big ones. And I would just say, maybe you don't travel this year. That takes care of that. I would say, though, for people that have college-age students that are going to be returning, one thing to ask them to look into is exit testing, COVID testing, because if they're coming from another place in the country, many colleges will offer that, and that could offer some peace of mind to the family. Especially if you have someone that has some health compromises. I don't have too much to say about debt, except, again, plan ahead, cope ahead, which is just to think about what you want to spend and then try to stick to it. But definitely don't go into debt anything beyond what you can pay in 3 months is the rule of thumb that I've read. That seems even high to me. Okay, so next I want to change the topic a little bit and talk about a model for thinking about all this stress and how we can manage it. And it's called Stress First Aid. And stress first aid, there's a few major points. It comes out of the National Center for PTSD at the VA. And it's based on research from studying who copes well after disasters or after stress, either man-made stress or like wars or pollution or natural disasters like hurricanes and floods. So the first idea of this model is that stress, we all are under a lot of stress, and at times we're all going to have reactions to that stress. And some of them may not be pretty, but they are all on a continuum, you know, that goes from mild, you know, where you feel like your stress is really pretty low, you're pretty well rested, you feel prepared for your day, you're motivated. Okay, that's the green zone. But some people say that the yellow zone, where things are starting to pile up and you're starting to notice it's affecting you, affecting your mood, maybe you're getting a headache, you know, maybe you're having GI upset, that the yellow zone has become the new green zone, unfortunately. And then moving into more significant effects of the stress, where people actually feel injured by the stress. It doesn't have to be a permanent injury. And all the way to red, where people might have an actual, they might have developed an actual mental health disorder like major depression or post-traumatic stress disorder, or fallen into substance abuse and addiction. And at that end of the continuum, we really need to reach out, and we probably need to reach out to people who have some expertise, like mental health professionals. But most of us are moving all the time on this stress zone, moving from, you know, maybe on Tuesday morning, I started out, I was feeling pretty good, you know, maybe lime green. And then by, you know, the end of Wednesday, I was burnt orange. And the point of it is, and this is the second major point of the stress first aid model, is that there are things that we can do to help us move back towards the green. But we just have to be willing to check in with ourselves, like where we're at, and then be intentional about doing the things that we know can help. So what are the core actions? So again, this comes out of research from mass trauma, like disasters, like earthquakes and hurricanes. And the first key factor is a sense of safety, which might be literal, like, you know, I'm not going to get shot, or I'm not going to get swept away by the tide. Or it might be more psychological, like I'm really not comfortable right now. I'm really worried that I might get sick, or I'm worried that somebody else is going to get sick. So that's a sense of safety. Calming is ways that we can literally slow down our heart rate and calm our nervous system. Connection is our social connections, which has really been shown time and time again to be a very critical factor. Self-efficacy is things like that make us feel competent, things that make us feel like we've got this, you know, that we know what to do on the job. We know how to handle the toddler's tantrum or the teenager's pout or flaunting of your well thought out rules. And then there's hope. And hope, of course, is being able to look forward in a positive way and not to fall into imagining that although things may be hard now, that they'll always be that way. So this model of stress first aid was developed especially in the Marine Corps and in the Navy. And so they changed those so that they each started with the letter C, so that they would have then 7 C's. So it's a little cute play on words there. So let me just talk about this, and then I want to turn it over to Susan. But check and coordinate are 2 actions that you're just doing all the time. And checking is just what it sounds like. How am I doing? You know, where am I at? You know, how's my stress compared to yesterday? And it's also checking out the people around you. You know, like how's your coworker managing? You know, how's your partner managing? Just observing and checking in. Coordinating is being aware of the resources, and we're going to talk about those next. What are the resources? But it's resources that might just be, you know, talking to a friend. It might be talking to a coworker that you trust. And it might be using other resources like the community mental health system or your employee assistance program at work if you have one. So that's check and coordinate. Those are repeated throughout. And then these other 5, you're not going to do every day, but just as they seem to fit. But so let me talk a little bit more about what they are. So calm is ways to calm your nervous system. It's actually the parasympathetic nervous system. Things like deep breathing. If you breathe in through the nose and hold the breath long enough, you know, to feel the tension deep in your lungs, and then let it out slowly through pursed lips, like you're deflating an air mattress. That seems to stimulate the parasympathetic nervous system, and it can kind of bring down the heart rate and help people to regain perspective. Practicing meditation or other meditative, like mindful meditation or other meditative practices, or exercise. Those are all things that help people to calm down. Connect is staying connected with others. It's not only having people that you can turn to for support, but being compassionate with others, giving as well as being open to receiving support. Competence is gaining confidence in how you're coping or how you're doing, let's say at work or at home. But it can also be in terms of self-care. And the key is to find small victories as you move through every day, setting small, achievable goals and then meeting them. That lends a sense of control and it helps us to feel competent. And it can also contribute to the last core action from the stress first aid model, which is confidence. Confidence is about finding meaning in this crisis, working to stay hopeful. And I say work because sometimes it is work. Making gratitude lists, sometimes when I think about that, it sounds pretty hokey to me. And sometimes when I do it, I feel better. It's worth exploring. And then the other thing is regaining perspective. So, for example, one way is to ask yourself the question, a year or two from now, how do I want to look back on how I managed this very difficult time? And that may help you to not be so wrapped up in the stress of the moment. It helps to get that perspective and can lend some sense of hope. So Going back to the stress continuum, speaking of the red zone, where we're really affected by stress and to the point where it's hurt us. I just want to make one comment about the distinction between sadness and the popular use of the word depressed. People say I'm depressed, and a more clinical, more severe depression, clinical depression, or major depression, as we call it. And it's really, the difference is in terms of severity of the symptoms, and it's in terms of how long they last. So they have to be quite severe, your mood more down than up, and it has to go for at least 2 weeks to have that diagnosis of a major depression. And, it often will affect other systems like sleeping and eating, concentration, and can cause people to feel suicidal, to consider hurting themselves or committing suicide. So it's really important that this model is not intended to solve every problem. It's intended to be a self-care model, and it's intended to be a peer care model, caring for our peers. But it also makes room for referring to outside, referring to professionals and mental health professionals and other supports as needed. And really the point of the model is to destigmatize reaching out for support when you need it. And with that, I will turn it over to Susan. Oh,
thank you, Dr. Cole.
Stop.
Thank you, Dr. Cole. So one of the 3 things that I wrote down when you were asked us about our stressors was the technology related to this webinar. And so I'm going to try and share my screen. And I did put down, I figured I had a 50-50, oh, that's the wrong, 50-50 chance of getting it right. And there you go. Try it again. Okay. So I'm really pleased to be here with you all tonight. Thanks so much for joining us. As Angelica mentioned at the beginning, I'm Susan Stearns, and I'm the Deputy Director at NAMI New Hampshire, the National Alliance on Mental Illness, the New Hampshire chapter. We're a grassroots organization working to improve the lives of all people affected by mental illness and suicide through support, education, and advocacy. And that's across the lifespan, really, from young kiddos to older adults. Dr. Cole referenced, and I wanted to give you a little bit of overview of some of the resources that are available statewide here in New Hampshire. The New Hampshire Community Mental Health System is comprised of 10 community mental health centers. They cover the entire state. They each have a region that they serve, so which one you go to depends on where you live. You can find out more about the mental health centers either at the website of the New Hampshire Community Behavioral Health Association that I'm sharing here. You can also find that information on the Department of Health and Human Services Bureau of Mental Health Services website. So if you go to the website, you can put in where you live, find which mental health center would be your local mental health center. And they also have resources, as you can see, particularly right now, they're running a series of pieces around COVID-19 and mental health. So really good education and information that you can find there. At your local community mental health center, you can access a broad array of mental health services, from therapy, family therapy, psychiatric services, including medication management, group therapies, co-occurring disorders, so treatment for mental health and co-occurring substance use disorders. You can also receive case management depending on your level of acuity. They provide services that help folks with their daily living activities, functional support services, and services can be provided in their offices. During this time of COVID, Many of those services are available virtually. They also provide services in the community where folks might need that level of care. So they're a really important resource, especially all 10 mental health centers offer emergency services 24/7, 365 days a year. So if you or a loved one is experiencing a mental health crisis, your community mental health center's emergency services is there as a resource for you. You can find that information again through this website or the Department of Health and Human Services. And of course, once you know your community mental health center, to their website, you can find the number for their emergency services. We do have 3 areas of the state where there is a mobile crisis response team that is available for folks. And those are teams of emergency services clinicians that respond to calls from folks who are experiencing psychiatric emergency and can go out into the community, go to your home, some other place in the community, your place of business, in order to do an assessment and provide assistance. Those 3 regions that operate at this time are the Greater Nashua region, the Greater Manchester region, and Greater Concord. The good news is that the state has issued an RFP seeking to expand those services statewide. So hopefully in the future, mobile crisis response will be available to all Granite Staters. In addition to 10 community mental health centers, there are also 10 peer support agencies that are, again, cover the entire state. You can find a listing of those at the Department of Health and Human Services website for the Bureau of Mental Health Services. That link is here, and it's also going to be shared. All these resources are going to be shared in the chat. And I'm always happy to share my slides after the fact. That's not a problem if that would be helpful to folks. Peer support services are provided by trained peers. Those are folks who are living with mental illness in recovery themselves, and they are trained to provide support to other individuals in mental illness to assist them with their recovery. The services can vary from peer support agency to peer support agency, but they do always include peer support, usually face-to-face or telephonic. Of course, during this COVID time, all of us are learning how to use virtual means to do a lot of that stuff. They also can offer warm lines, provide trainings, a lot of assistance with developing self-advocacy skills. Several of them have crisis respite beds. So those are beds where individuals who are experiencing some increased level of acuity in their symptoms can stay on a very short term for a few days, where if someone's not feeling safe at home, but not needing the level of care of a traditional hospital stay. Beyond those New Hampshire resources, there are nationally several crisis lines that are available 24/7, 365 days a year. First and foremost, the National Suicide Prevention Lifeline. You can reach them at 1-800-273-8255. I encourage everyone actually to put that phone number in your cell phone. And I can't tell you how many times after I've encouraged someone to do that, they have told me that they have actually used it. Because the thing with the National Suicide Prevention Lifeline is, even if the person you may be concerned about is not willing to call, you can call and ask for assistance, ideas, resources, and what is it that you might need to do to intervene. So it's a great resource to have. For folks, veterans, as well as active military members, the National Suicide Prevention Lifeline also runs the Veterans Crisis Line. It is the same phone number, that 1-800-273-8255, but you press 1 after you get through. And what that does is it means that you will be connected with a trained veteran who can provide assistance and really understands the unique needs of veterans and service members and their families. So always encourage folks that you know who served to use that line and press 1, and it's been shown to be very effective. In addition, for folks who perhaps aren't as keen on calling, there is the crisis text line. Pretty straightforward. You text to 741-741, and you can engage with a trained crisis counselor via text. And then for our LGBTQ youth, the Trevor Project is doing wonderful work in terms of addressing the needs of that population, whom we know because of lack of acceptance and discrimination can be at an increased risk of suicidality. So the Trevor Project offers texting, chat, and a lifeline, a traditional phone line, and are available 24/7, and again, are trained to meet the needs of that specific population. But I would always fall back on the National Suicide Prevention Lifeline number as sort of your first go-to. It's great to have all these tools in your toolbox, but that's probably the number you want to make sure you have access to. So at NAMI New Hampshire, I mentioned that we provide support, education, and advocacy services. In terms of our education programs, we have a number of them that designed to address the needs of various populations. First, we have our Parents Meeting the Challenge. First, because it's on the slide first, there's not in any actual order. Parents Meeting the Challenge is an 8-session educational program for parents or caregivers of children under 18 who are experiencing mental health challenges. And it provides basic information on mental health challenges in young people, as well as tips and tools for advocating for your child, navigating the system, dealing with schools, etc. It's a great opportunity to meet other parents. It's taught by someone who has that lived experience, who's raised a child who had a mental health challenge, actually taught by 2 folks, and is a great way to connect with peers as well. That is offered, actually all of these are pretty much offered virtually right now because of COVID, and that is one of our programs that was offered both virtually and in person prior to COVID. Family to Family is a NAMI national signature program. It is an 8-session program, similar idea to Parents Meeting the Challenge in that it's an educational program for family members who have a loved one living with a mental illness. This is an adult loved one. And it's a wonderful tool, life-saving for many families, helping you understand the mental illness, develop techniques for communicating with your loved one, especially when they're symptomatic, and understand again how to advocate, navigate the system, access the help that your loved one needs, and difficult things like how do you handle it if your loved one doesn't want your help? They are an adult. So it's a great resource. It is taught by trained volunteers. Again, these are folks who have lived experience with a family member or loved one living with a serious mental illness. And they are trained teachers. All family-to-family classes right now are offered virtually. They had not been prior to COVID, but we have seen an expanded reach geographically by having it virtual. So a little silver lining for us there. Side by Side is a 6-module education program developed by NAMI New Hampshire. It's specifically for caregivers of older adults with behavioral health challenges. So that can be depression, dementia, serious mental illness, substance misuse. And Side by Side is actually the module standalone. And right now we are running a series online offering Side by Side. So you don't have to do all 6. You can do it by topic. Mental Health First Aid is a national best practice that is usually 8 hours, but it's shorter in the virtual world, and is essentially what it is. When you're done, you are officially a mental health first aider. You understand mental health, how to interact with someone who perhaps has experienced a crisis, and how to seek help for them. Our Connect Suicide Prevention and Postvention trainings are national best practice, designed on a community-based model for intervening and preventing suicide, or in the case of postvention, developing community resilience and healing after suicide. Peer-to-Peer is an 8-session program for individuals who are living with mental illness. It is taught by individuals with that lived experience who are trained to teach it, and it helps someone understand their mental health challenges, how to self-advocate, how to navigate the system, and also perhaps how to handle family members that may be so concerned that their concern feels a little overwhelming. So it's a great resource. We have a peer-to-peer class starting in January, and family to family is coming up. We've got some running right now, and both family to family and parents meeting the challenge are starting soon. And then crisis intervention team training is a sort of the gold standard for police training around intervening with folks experiencing psychiatric emergencies. It's a 40-hour training, significant investment by law enforcement and other first responders to send their staff. And we are very lucky right now to have a grant that allows us to offer that training 3 times a year to first responders, primarily New Hampshire State Police, fire, EMT, but also some local law enforcement here in the state. In terms of advocacy at NAMI New Hampshire, that is the sort of third leg of our 3-legged stool. Creating systems change to improve outcomes for our loved ones living with mental illness is core to our mission. We offer education programs to help folks around the state learn how to advocate. Those are It's Your Move, which is an introductory course, so to speak, and It's Your Move 2.0, which is more intensive in how to advocate and navigate the legislative system. And so both of those are offered usually in January and February, and they will be virtual this year, so they should expand their reach. Then we have 3 speakers bureaus. In Our Own Voice is made up of trained speakers who are living with mental illness themselves, and Life Interrupted are trained speakers who are family members of individuals with mental illness. Survivor Voices is for survivors of suicide loss who are trained to tell their story to promote hope and healing in order to prevent suicide. All of those are highly sought after programs and proven very effective at combating stigma and discrimination. And we are currently offering some of those online. Actually, next week on the 18th, we have an In Our Own Voice presentation coming up online that I'll give you the information further along here. And then one of our biggest awareness raising events is our NAMI Walk New Hampshire, happens in October. We have next week our post-walk celebration coming up to finish off this year, but it will again be in October next year. We did it virtually this year, and actually it had over 1,000 people participating, great response. And so, keep an eye out if you're interested in participating next year, because it takes all of us to raise that awareness. So in addition to education and advocacy, our support groups, these are support groups that traditionally have been primarily in person. They are all virtual right now. We have support groups for family members, friends who have a loved one who's an adult living with mental illness. We have support groups for parents and caregivers of children with mental health challenges. There are a number of support groups for survivors of suicide loss around the state. We also offer a couple of support groups for individuals who are living with mental illness, peer support groups. One of those is open statewide virtually, and the other one is virtual, but only for their Concord region. But there is a statewide virtual one there. And then we also have a first episode, early serious mental illness support group just recently started, for families who have a loved one who has recently experienced either early serious mental illness, the onset or first episode of psychosis. And that is virtual and will continue to be virtual after the pandemic because it's such a specific, unique audience. And the intent is to make sure it can be accessed statewide. In addition to those supports, we have on Facebook, we have 4 support groups that are closed. You have to ask to join them and abide by the rules that are laid out, the principles of support. But they are a wonderful resource because they are available 24/7. We have one that is designed for families who have an adult loved one living with mental illness, another for parents and caregivers of children with mental health challenges. We also have one that is specific to that population of families who have a loved one who has recently had that onset of an early serious mental illness or first episode of psychosis. And then we also have one for military and veteran families. We also provide some one-on-one support in a limited basis, and that is where we have staff who will work directly with family members or individuals affected by mental illness. We also have on our staff a military and veteran family support specialist who is her husband is active military right now, and she will provide one-on-one support to our military veteran families who outreach us. And then we are able to provide more in-depth, intensive family peer support as part of the state's wraparound model for children with behavioral health needs. So that's something that we're able to do for families for a longer term than our other one-on-one supports can be for several months a year. So those are all resource supports that we can provide. You can contact us on our info and resource line. It's not a crisis line, although we do try and check it 7 days a week, even on weekends, but it's not a crisis line like those numbers I gave you earlier. And that number is 1-800-242-6264. And you can also email us at info@NAMI-NH.org, and we'll get back to you and set up a time to chat. So especially, we always do webinars and online presentations, but all of our things have been online, of course, since March. So I mentioned that we do have coming up next week on November 18th, an opportunity to hear one of our interim voice speakers. Kevin O'Brien is a 15-year Air Force veteran who tells a compelling story of his recovery from particularly PTSD. So there's a link there, and I believe that's going to be in the chat as well. I might be wrong about the chat link, but if not, I can get it to you. And so that you can register, because you do need to register in order to receive the link. And then we also offer right now on Mondays and Wednesdays, online yoga and meditation at noon. Again, you need to register to get the link. I would highly recommend it. I try to do it every Monday and Wednesday, and I have it written into my calendar to try and keep it sacrosanct. And I will tell you today, I felt really tired, and then I did the yoga and I felt like rejuvenated. So, and I'm really not like I like yoga, but I'm not a huge yoga person. So just some ideas if you want to find more information. There's our website, which is NAMI-NH.org. And I've also included the links for our Facebook, Twitter, and Instagram pages, particularly our Facebook page. If you go on Facebook, it is very active. We have a broad reach, and we do get all of our offerings on all 3 platforms. We just see more engagement on our Facebook page. But if you're on those platforms, please like us, follow us, check it out, and that'll help keep you up to date with what's going on, and you don't have to always remember to check out the website. Oh, you can on our website also sign up for our e-news, which goes out every 2 weeks. So if you go to the website or on the homepage, you can sign up for e-news, and then you'll also receive this information by email. So yes, especially on this Veterans Day, we are so grateful for the service of our veterans, service members, and their families. I did want to just touch on briefly, some of the experiences, the impact that COVID is having on service members and veterans. That, in addition to what we're all experiencing, service members right now are not allowed to travel more than 300 miles from their base. So their isolation is, they're far from their home base, their home states, they're far from their home networks, their systems of support, and they are not able to travel. So the isolation, which is very often there for military families, is heightened right now. And then for veterans living alone, and this is especially true in New Hampshire's North Country, they tend to be older, and they do find it easier to connect when they are able to be in person rather than this virtual arena. And also, as I'm sure most of us are aware, And you get into some of those more northern parts of the state, and connectivity is not great. Broadband access is difficult. So it is more of a challenge. Our Veteran and Military Family Support Specialist, Kimberly Somariba, mentioned to me that the term that they are using in the military is that this is a marathon of patience, this COVID-19 experience. And I thought that's a good way to look at it, because it is a long haul, but it will end. So I made a note of that here. Again, through our info and resource line, you can access one-on-one support for service members, veterans, and their families. That we will ask if they or a family member have ever served, and that is anyone ever served in the family is the question, and it doesn't matter discharge status or anything like that for us. And if that's a yes, we can connect them with Kimberly, the Veteran and Military Family Support Specialist, who can provide some time-limited one-on-one support and help folks get connected with other resources. In addition, I mentioned the Veterans Crisis Line. There's also a texting number for them, 838-255, again, 24/7, 7 days a week, 365 days a year. Veterans Crisis Line is available. Again, we have a veteran support group for Facebook support group for veterans and military families. On the VA's website, they have an app store, which has in it some really very well done, very useful mental health apps. One of them is that is highly recommended is COVID Coach, but there are some others in there. So the link for the mental health page of the App Store is here. There's ones on mindfulness, depression, managing symptoms. So it's really a great resource. Also, a program called NAMI Homefront is another NAMI education program that is offered online, and that is specific for the needs of veteran and military families and helping their loved ones cope with mental health challenges or just the struggles that they may be feeling with, for example, returning home after being deployed. So it's a great resource, education program for service members and veterans and their families, helps them navigate the system, figure out how to access some of those resources that can be a real challenge. I mentioned the presentation coming up. So some quick tips for this marathon of patience. Some of these may seem a little redundant. I have a couple of different takes. One of them is absolutely get outside every day. Try to get outside for at least 10 minutes. It will definitely make you feel better. I mean, 20 is always better than 10, but at least 10 makes a difference. The sleep thing, I hear you, Dr. Cole, it can be a real challenge to get enough sleep. And, you know, I think we all try and work on that. We know that we shouldn't, for example, look at our electronic screens in bed. And, you know, I probably will get into bed and scroll through Twitter tonight. So, but we know we shouldn't do that. And we know it's really important. One of the things that always has stuck with me for a long time, my son's therapist, when he was in his teens, said to him that in sleep deprivation studies, 100% of the participants in those studies exhibited depression. That's how challenging sleep deprivation is for us. So getting enough rest and really making that a priority in your life is important. Dr. Cole mentioned exercise. You know, it can be a real challenge sometimes. You know, the real key here is probably building a habit, and maybe you just start with 10 minutes a day and just say, I'm going to do 10 minutes a day. And it can vary from person to person what that's like. And then and if the weather's not good, especially now it's getting dark early, I've been known while I'm cooking dinner to do laps in my kitchen just to try and get a little bit of exercise in, especially in the winter if I get home late and it's cold. You know, so definitely try and move. There are a lot of online videos. Check them out. It really will make a difference in your life. As I said, I put the yoga in my schedule every day, every Monday and Wednesday. And then I also do it on my own in the mornings the other days. And if I don't put it in my calendar, it's real easy not to do it. Definitely look into yoga if you think it might interest you. If you're not doing it, there are a lot of free videos. If you're not interested, you're able to join us for the NAMI New Hampshire Yoga and Meditation, and they vary in length. Those videos. There's also a great website called Do Yoga With Me, and that should be in the chat. Dr. Cole mentioned nutrition. My rule of thumb on nutrition is one, try to avoid sugar and refined carbs. Yeah, we all know that. The other one is eat from the rainbow. Try and have a colorful plate because then you get a whole host of variety of nutrients that you might not otherwise get. So I think about it as colorful as I can get with my plate, which also means you're getting a lot of vegetables. They should be natural colors. Another one that we hear a lot about is that 8 glasses of water every day. There's not actually research that says it has to be 8 glasses. We just know that you need to stay hydrated. And with working from home a lot, it can get really hard sometimes. At least I find I can be sitting for a really long time. But if I have to get up and get a glass of water because I've set my goal, like I want to drink X amount of water in a day, it's a reason for me to get up and move. So I try and look at it as a bonus in that respect. Dr. Cole mentioned gratitude, and he's right. It might feel hokey, but there are a lot of different gratitude rituals. And there's a really good research that shows that it's effective in improving mood. So definitely check it out, Google it. There are some websites you can sign up and they'll send you reminders to do gratitude things. I know a lot of people do gratitude journals. You can also build it into, a nightly ritual of prayer or meditation if that's more your thing. But it definitely will make a difference. I know we are all Zoomed out, but right now, things like Zoom are really a useful tool for connecting us. If it's setting up your Zoom screen on your dining room table for your holiday dinner, to just using it for an opportunity to sit and have a cup of coffee with a friend, try and stay connected. And it doesn't have to be on video. Another great tip is get yourself a headset for your phone, go take a 10-minute walk and talk to a friend. Even better, schedule a walk with your friend and you walk together. Those are things that not only will you get your exercise in, but staying connected will really improve your mood. The other thing is acts of kindness. If you're able to reach out, check on your neighbor, see how they're doing. Don't make it another thing you have to add to your list, but when you do things for others, it also comes back and helps you feel good. Think about self-care as just filling that well, or as Dr. Cole said, that bank account. I have something that if I read a book, not Twitter, every day, I feel better. I know I do. And it's really easy to let that slide. So I try and make sure that I do spend a little bit of time, even if it's 10 minutes reading a book. Dr. Cole talked about time management. I read an article this morning and this one particular section really struck me because, we're all always so busy and you're trying to add more things to your schedule. What it said was the best predictor of how busy you will be next week is how busy you are this week. Think about it. How often do we say, I'm going to push that out to next week because this week's so busy, and then next week comes and it's like, how did it get so busy? So practice saying no. And yeah, this is the pot calling the kettle black big time here. But definitely try hard to guard your time because it's precious, and make sure that your yeses are ones that you really want to give. Couple other tips: decorate for the holidays. Do it now. They actually say folks who decorate early tend to feel better in this as the days get darker. So go ahead and do it, even if you're usually one of those people that says no way, you can't do it till Christmas Eve. This year, maybe go ahead, but don't worry about it being perfect either. If the kids want to put up some bright lit thing that you think is tacky, just do it, right? Especially if it means just stand it up and plug it in. So try and go easy on yourself, but you make things, a little prettier. The reality is that a lot of those things, lights, greenery and such, were pagan rituals that were adopted as Christianity was spread across the globe. So and there's a reason for that, because indeed during the winter months, the darkest time of the year, the need for those lights, fire, greenery, signifying life is very important. And if you're not celebrating Christmas, it's not your thing, there are all sorts of lights you can get. I have a set of jalapenos that lights, just find something to make things a little brighter because it's a very dark time of year. If you can afford it and you go to the grocery store, treat yourself to a little bunch of flowers every now and then. Again, having things that, bring some greenery in, some color will make you feel better. Be creative. If you're crafty, definitely make time for your crafts. Don't feel like it's a waste of time. And if you're not crafty and you want to be, now's a good time to start trying. The other thing, be creative in your life in terms of, try and make things fun. A lot of us, we're not going out to eat, for example. So one of the things that I did was I made little restaurant signs, depending on what we were eating, and I put them up by our entrance to our dining room. And they're all a play on the word fox because my partner's last name is Fox and he does all the cooking. Yes, I know, I'm very, very lucky. So, we have the Fox and Hounds pub sign I made, for example, so that if we have burgers, I'll put it up. The other thing, if you have some candles, go ahead and light them. You may have those special candles you've been saving. It might be a good time to use them. And this year, if your holiday is smaller, you don't necessarily have to do that big traditional dinner. You could do something different. You could do another special dish that maybe won't feel as much of a chore, but is still special to you. And then, as Dr. Cole said, definitely be kind to yourself. I think we're often kinder with other people than we are ourselves, and we can be our own worst critics. Definitely remember to take care of yourself. And also, if you got family you're feeding, one of the things I always tell my kids is no one ever dies from eating breakfast for dinner. So definitely make it easy. Try and, make this as bearable as possible. Life is a challenge for all of us right now. So with this marathon of patience, just remember to pace yourself. You don't want to burn yourself out. And this is a little aphorism that my friend Cindy told me her mom always said to her, which is, and I find is a useful reminder, and it's easy to remember. Yard by yard, life is hard. Inch by inch, life's a cinch. So yeah, try not to bite off too much at once. Remind yourself of that. And then the last thing I have here is from the Talmud, just about not being daunted by the enormity of the world's grief. Do justly now, love mercy now, walk humbly now. You're not obligated to complete the work, but neither are you free to abandon it. So I find that was things that often help me, and you may have others. Think about what are the things that you can tell yourself that are self-soothing. And again, here's our contact information. And I think we probably have some questions coming in, and I probably ran a little over there. So I will stop sharing my screen. I'm hoping Dr. Cole's coming back.
Hi, great, thank you. Hi, it's Angelica. So we do have some time for questions. If anyone has any questions, you want to and submit those through the Q&A function, or if you would like to raise your hand, I think that we have the ability to allow you to actually ask questions that way. So if you have any questions, please feel free. I guess you've answered all the questions for the night.
Well, I think there were some questions about seasonal affective disorder, and I could just say a few words about that. So seasonal affective disorder is a form of depression, and It's thought to affect about 10 million Americans every year. And there's some common misunderstandings about it. People think of seasonal affective depression being associated with mud season, you know, when we're all like totally ready to get outside. We have cabin fever, and but it's actually it's last month when people start to, even late September, as soon as the light changes, that's when people who are susceptible to that problem start to notice it. And there are good treatments. It can be associated with vitamin D deficiencies, but I would encourage people to talk to their primary care doctor to get a blood test to see whether you actually have a vitamin deficiency. And then there are full spectrum lights, which can be very effective. And the one thing that I would say about that is you really only want to use it in the morning or whenever the start of your day is, and just for 20 to 30 minutes maximum. The light has to be, it's a very specific bright white light, and it's full spectrum, and it has to be a unit of measure, lux, L-U-X, has to be 10,000 lux in order to be effective. And then you have to have it really close to your head. You don't have to be looking into it, but you know, it should be like half an arm's length away from your head. For daytime people, in the morning, like 20 minutes. But it's interesting, seasonal affective disorder, it's by survey data, we know that the incidence rates varies with latitude. So like the rate in New Hampshire is 10% of the population say they experience more depression in the fall and winter. And it's only 1.4% in Florida see a seasonal pattern. So I'm always concerned when we have people coming in from southern climate countries or southern parts of the state to work here, because it's quite an adjustment.
Yeah, we did have quite a few questions, so thank you for tackling that. We also had a question previously that was submitted with registration about dealing with, you know, pre-existing depression and disorders. So someone had complex post-traumatic stress disorder, and this year has been really triggering for them. So could you kind of just touch on that and what they might be able to do this holiday season and this winter season?
Sure. I mean, first of all, I would say definitely reach out. Like, don't suffer in silence or isolation. There are good treatments available, and if you've been in treatment and it's been helpful, go back. And if you were in treatment and it wasn't helpful, then find somebody else that maybe might be more helpful. Sometimes a combination of counseling or psychotherapy and medications can be helpful, especially if the symptoms of the PTSD are affecting sleep, because when people are in a state of heightened alarm all the time and they can't relax, they can't slow down and sleep, then it tends to intensify that. It's a terrible cycle. It tends to intensify the symptoms. So yeah, reach out and get some support.
Thank you. Do you have any final thoughts before we kind of wrap up, Susan?
Just remember to be kind to yourself, be kind to one another. It's a hard, challenging time, and definitely be creative. You know, I think For example, I was talking to someone today who was talking about how difficult it was right now because everyone's working out at home to purchase online any, little dumbbells, and they were using soup cans. So, think outside the box, just, and take good care of yourself.
Dr. Cole, any final thoughts?
I think those sound like great final thoughts. I'll let it go with that.
Great. Well, I just want to thank everyone and just want to thank you both for being here and for presenting tonight. This is such an important topic. And I know that we're going to have a Facebook Live event next week. Is that right, with Dr. Conroy and Dr. Calderwood?
At least Dr. Calderwood.
Yeah, talking about how to deal very specifically with the seasonal stress. So that's going to be on Facebook Live next Wednesday at noon. So stay tuned for that if you're interested in hearing more. And
yeah,
again,
it's specifically about making weighing the risk benefit, and what are the risks and how can you protect yourself and those considerations. So
yes, yeah, thank you. And just to a reminder, there will be a survey at the end that will be sent directly to you. So if you could please fill that out. Again, that helps us with programming in the future. But for now, we just want to thank you all for being here. And we hope that you have a great night. And we hope that some of this has helped you so that you can have as pleasant of a holiday season as you can. And thank you all and have a great night.
Good night.
Nice.
Thanks, Angelica.
Thank you.